Got it.
Thank you. All right. Welcome everybody to our, I always have to look at the calendar, May Comagine Health Patient Family Partnership Hub. We appreciate you all joining us today. Oh, Lindsay, you have the slides. Next slide, please. I'm here trying to change them. Here's some Zoom features for you all that we'd like to go through before each meeting. We have chat available if you would like to chat anything in during our discussions. You can also direct message somebody by clicking their name in the drop down. And if you have any questions or anything for a specific person. We also do have live transcript available. If you click the CC down at the bottom of your screen, if you need some live transcripts. And then if you'd like to come off mute during a discussion, you can raise your hand by using the reactions button and raise hand. Next slide, please. Go. And we don't have Katie with us, but we are partnering with Comagine Health, and their mission is together with our partners, we work to improve health and create a better healthcare system so that people and communities will flourish. And then we are PFCC partners, again, partnering with Comagine Health to bring this hub to you all. Our mission at PFCC Partners is to center the inclusive human experience of health, reinvent through radical collaboration, and be a catalyst for system transformation. We do that with our vision of a health system transformed, one that works with people and through communities as a partner in their well-being, and our values are equity, inclusion, diversity, collaboration, and being solution focused. And again, this is the Comagine Health Patient Family Partnership Hub. We offer engagement opportunities for you all, PFCC events, community skills development, and some of you are coming to us from existing PFACs. We kind of incorporate anyone in the Comagine Health kind of sphere into the partnership hub. And these are our meeting agreements we go through before each meeting. A couple of these are we provide context and discussion questions prior to the meeting. We again use that Zoom raise hand if you'd like to come off mute, and the chat is always available as well for you if you don't want to come off mute. And we do record these meetings just for notes, and the summaries are shared in follow-up after the meetings. And then if you have any concerns during the meeting, you're more than welcome to private chat anyone, Comagine Health or PFCC partners. So I think today that's Lindsay, myself, or Savannah is on as well. Next slide, please. And our agenda for today, we will debrief a little bit of the conference, the PFCC conference. We had Jan and Joan present, and Chris Severson was there as well. So we'll do a little bit of a conference debrief. And then we have Julie Farnsworth with us today, and she's going to go over Comagine's current focus, what to look forward to in the future, and we will share some engagement opportunities. Next slide. All right, we will do our welcome. So let us know your name, where you're calling in from, and what is an easy way, a simple thing to do, something nice for someone. So I can start us off. My name, as I said, is Laura Jackson. I am the Director of Community at PFCC Partners. I am located up in Eugene, Oregon, although our offices are down in Long Beach, California. And an easy way to do something nice for someone, I try to compliment a stranger. If I see someone wearing a nice shirt or someone has really pretty hair or something like that, I always like to compliment them, speak up and compliment. To me, if a stranger does that, it always brightens up my day. So that's my answer. I will go down my list here. And I'll start with Bob. Welcome.
Hi, thank you. Yeah, I'm Bob Crabtree.
and I'm from Linwood, Washington. I'm a patient, transplant patient. And I think the nice thing that's really easy to do is smile and acknowledge people.
Absolutely. Thank you, Bob. Thanks for joining us. Donald.
Hi, my name is Donald Morgan. I'm from Hayden, Idaho, and I'm a kitty transplant person myself, as well as Bob. And I just like to tell people to have as wonderful day as the day is, Hope your day is as wonderful as the weather is, or whatever, just a small compliment.
I like that. Thank you, Donald. Thanks for joining us.
Thank you.
Joan.
Hi, and I guess I should say ARG. I look like a pirate because I have had a right eye cataract removed yesterday afternoon. So please forgive me. I know it's not Halloween, but I am emulating a pirate today. So how do I make, and well, first off, I'm from the Utah office. I'm a consultant. I work with the Utah PFAC and work with the Utah Geriatric Education Program. And how I make people feel, I try to do this every time, and I'll be candid with you. I learned it from former President Bill Clinton. When I met him up in Park City, it was in a group, maybe 30 people, but he focused in on me when he was meeting me, shook my hand, said something very, germane to me. It was about my turquoise necklace and their trips out west. And I felt like I was the only one in the room. And I thought, boy, I can learn from the master on this. So what I try to do in the when I meet people is really focus in on them, grab their hand and look them straight in the eye and really try to make them feel special.
Nice. I love that. Thank you, Joan. And I hope you feel better soon.
Well, I feel better. I just look funny.
Well, thank you for joining us anyways. Chris Severson.
Gosh, there's so many things. I think, Laura, like you just, saying something nice to people. I try to do that. If I see something that I think looks really cute, I'll just say, oh, what a cute top or whatever. Yeah. But the other thing is kind of combines with what Joan said, but remembering someone's name is really, really meaningful. And I, for some reason, have found that has been a really good thing for me to do, is to remember their name and remember something about them. Like Joan, I remember your dogs now.
Chris and I are new best friends after the PFCC.
We're new best friends. Yes, we had an experience. Laura, talking to you about Eugene. Just so many different things. But I think remembering them really makes them feel special.
Mm-hmm. Absolutely. Thank you, Chris. And Jan.
There we go. Jan Lambert in Salt Lake City, Utah. I'm the Utah PFAC also. You've all hit the best things right on the head, right? Especially when you're meeting people in person. I love that we can text too, and to follow up and just say, oh, it was so fun to see you today, or whatever. I really appreciate getting just little short texts, even from friends, when I've seen them or had lunch.
Absolutely. Thank you, Jan. Thanks for joining. Savannah?
Hi, my name is Savannah, and I live in Smithfield, Utah. I work for Comagine Health as the Health Equity Program Manager. I think something nice for a stranger, I always try to hold the door open for people because I like when people hold the door open for me. And personally in my family, I really try to make an effort to FaceTime instead of phone call if that's possible. Particularly my grandma and my mom, since I live so far away from them, but I talk to my mom like 70 times a day. And I always try to FaceTime my grandma at least once a day because I am the preferred grandchild. So it just keeps me up on the totem pole of being the favorite.
Yeah, you got to stay up there at the top, right? Yeah. Thank you, Savannah. Libby.
I'm still having trouble with my mute button. Hi, everybody. I'm Libby Hoy, the founder and CEO of PFCC Partners and in Long Beach, California. And I guess one easy way to do something nice for someone, it's just simple, but I do like to walk around with a smile on my face and smile at people. So I think it's a way that invites people in and breaks down a few barriers. So just a lot of smiling.
Absolutely. Nice and simple. I like it. Thank you. Lindsay?
Oh, yeah. Hi, everyone. I'm Lindsay Galley. I am from Sacramento, California. I had to remember because I've been in Southern California for a whole week. I do, in fact, live in Sacramento. I think same with Laura and Chris. I like to compliment strangers. I'm trying to do that more and more because I read somewhere, or I probably watched a TikTok or something that said when you do that, it releases dopamine for that person and dopamine for yourself. So it just releases all those happy chemicals. So the more of that we can all have, I think the better.
Yep, absolutely. Thank you. And Julie?
So can you guys hear me okay?
Yes.
Awesome. So first of all, I just want to give you guys all my apology. My daughter, one of my daughters, graduated from the University of Utah today, and we are at her celebration lunch that took a lot longer than we thought. So I'm actually sitting in downtown Salt Lake, so you get all of the background noise and you don't get my face. So just apologies in advance. I am the Chief Operating Officer for Comagine Health. And let's see what I do. What's the easiest thing for me to be nice to people? I think two things. One, like Savannah, if I see someone that is in need of a door open or a bag held or help putting their groceries away, I try to be aware of those things. A lot of times I'm not even aware because I'm in my own world. So it's like being aware of others. And then the other thing I think, especially with my kids, I try to hold a very non-judgmental space for them, in that I hope that they can bring anything to me. And even though I may be reacting on the inside, I try really hard to be there and be that sounding board for them. So, because I'd much rather they get advice from me than from someone else.
Absolutely. Thank you so much, Julie. Those are great ways to bring something nice to somebody, and congratulations. That's so exciting. I love the graduation.
Yes, thank you. And I will, after my portion, I'll probably step away to join the party again. So again, my
Yes.
apologies in advance. I try hard to be in two places at once, but I'm not successful at that just yet.
That is all good. We will actually, we can start off with you so you can head back to your celebration. We want you to spend time with family. So I will actually make sure I got everybody. I think I did. And I will pass it off to you now.
Awesome. Thank you. So I think Savannah prepared a few questions, and Savannah, you may have to chime in and help me out, but I guess I'll just first start in kind of sharing with you where my heart is right now based on attending the CMS Quality Conference recently. And I'm so sorry that I had to, again, couldn't be in two places at once and miss the PFCC conference. It's the first time in a long time I haven't been there. But where my heart is and what I've heard is a very central theme right now in our healthcare system is one, patient safety has taken a significant blow from the pandemic. And I think what's been really vital for people to recognize is the importance of patients and families. I think not having the families at the bedside made it even a riskier place for patients. And then you think about people that don't have families to advocate for them. Our healthcare system is a dangerous place to be, unfortunately. And so the time to engage our patients even more and families even at a more deep level and be more committed to how we work on not a care plan, I heard this at the conference, but a life plan, really truly understanding people's goals before we practice medicine on them. So I can't imagine us creating any type of strategy in our organization without the voice of patients. When it comes to where I see our organization, or where I hope to take our organization next with this. So for those of you that are familiar with Comagine Health, you know, we have 4 different kind of main operating departments, and the majority of our patient and family engagement work is really in our quality department. And I think that's fantastic, and we will continue that. But I think it's time for us to spread that out across the organization. So right now we're having a lot of conversations about our community engagement strategy in the organization and what that means to us, especially as we look towards the next scope of work with Medicare and as we look at growing other types of work. But I also think it's really important for us to look at care management, to look at research and evaluation that has a significant amount of work in the opioid and substance use disorder space, as well as our data solutions team. So we have a lot of work where we have community health workers, where we have patient navigators, and I think it's time for us to align those strategies. Now, do I think it's a one size fits all? No. So I really want to search for a solution where we can bring all of this expertise together, where we're really getting information from the front line, from the people that matter, from the people we serve. But that has to happen across the organization instead of just in one department. So that's where my heart is. Do I have the perfect strategy lined out? No, but the time is right now for us to be thinking about how we organize a little bit differently in the organization to get all of that information, very rich information and very rich engagement that we have at our community levels, for more engagement and have those decisions and those strategy driven from patients and families. So Savannah, did you have other questions? Obviously in the block of Salt Lake City, I don't have access to your email in front of me.
No, you're good. I think you hit the nail on the head of, where the current focus is, what's on the horizon, where do you want to see our organization go? And maybe just if you want to touch on opportunities you see for patient and family engagement within our organization, if you have anything else to add, because I feel like you nailed it all in one fell swoop.
Sure. So I think that's where we have opportunity. I think, we have different structures in place where we've, we think about, giving the patient or the PFAC engagement when we design an intervention, or when we're developing a strategy, or when we're building a proposal. And I know we have some ESRD patients on the line as well, representatives, and thank you for being here. I think you lead the way in many ways and show us how to engage in a very deep and meaningful way, in a way that actually impacts the work or changes the work that we do. So for me, what I think we need to do is figure out and be more intentional about where we have other opportunities. So for example, we just had our board retreat in Las Vegas where we had our community boards, and I know Jan was there. Thank you for joining us, Jan. But one example is we have patient navigators or peer navigators working in substance use disorder that are seeing significant results and significant improvements in drug use and drug overdoses. And I just think that if we have that experience and rich expertise in our community, and we're not in our organization, and we're not figuring out how to translate that to other parts of our work, then that's just a missed opportunity. So for me, it's about how we have a more, this is a hard thing to do. We need both a more centralized approach and a more individual department or contract approach. So it's really very aligned with the model of the hub that we have here, which is how do you bring those patients and families together that are in different types of work across the organization, but in a way that's allows us to learn from each other and allows us to think about different approaches. So I think we all know that, that a patient advisory council is a fantastic way to do that. And the board is a fantastic way to do that. And there's also a lot of other things happening that if we do it well and we create the right processes and structures, we'll be able to inform and enrich those other processes that we have in the organization. So I know that sounds really high and lofty right now, because it is, but that's where I believe our next step is to figure out how to create structures so that we can learn from each other. And just, I just learned a ton from the research presentation that was given. So I just think that's what I want to do, is figure out how we take advantage of what's already happening in our organization.
Awesome. I love it, Julie. If there are any questions from anybody, I invite you to unmute yourself. I don't think Julie can see the chat, but if there's any quick questions before she jumps off to spend time with family, feel free to unmute and ask.
I just want to tell Julie, this is Joan. We always have a fun thing or a challenging thing that happens with us around Los Angeles. And we have fond memories of Julie driving through LA traffic and me sticking my hand out the window to butt in places. But I want to let you know, Jan, Chris, Diane, and Jody and myself had an errant Uber driver one night going to dinner and insisted that he took us to the right place. Well, it was in the really bad section of LA by an auto chop shop. And I wouldn't get out of the car. I kept saying, no, there's no restaurant here. We are not getting out. So I just want you know, poor Chris went on that adventure with us, but we were almost kicked out. 5 women out in a really bad section of Los Angeles, but I would not leave the car. Thank you.
Julie, I have a quick question. I'm just wondering, state PFAC versus the hub. Are you going to continue to try to build state PFACs, or do you think Comagine's work for the most part will center around the hub?
Can you guys hear me?
Mm-hmm.
Okay, you can hear me okay?
Yes.
Okay, sorry, I got in this weird setting on my phone. That is a great question. I don't ever want to stop something that's working. And at the same time, I think we need to figure out how to get other information from our other geographies as well. So right now, I think we have an imbalanced approach right now, and we need to figure out how to get more balance. So Jan, I don't have a crisp answer for you on that, other than where my focus is I want to figure out how we do a better job of connecting our patient and family advisors to our local community boards. So that does lend itself more towards thinking about how we engage more people in each geographic area. Does that mean a council? I don't know, but it does mean I think we need to figure out how to get the voice of those communities.
Thank you, Julie. It looks like Libby put in the chat, I wonder if we can focus on inclusion across all layers of the organization. It's a great point.
Yeah,
That is
I just
fantastic.
oh, sorry. Kind of building on what Julie was mentioning, I think that there's a lot of opportunity to, build in layers of patient family engagement and different structures for different, but have a unifying vision for what patient family engagement and how it feeds the organization. But I think, yeah, if you focus on inclusion, the structures will begin to emerge, I think. Just a thought.
Agree. I think that's a fantastic point. And I think just by focusing on inclusion, that's going to allow us to get more of the work that I was talking about represented, and more of the people that are boots on the ground. It reminds me of being a CNA when I was in college, where we really wanted to push down those decisions closest to the resident, right? So I want to do the same in the organization, is how do we do as much as possible to push down that engagement closest to the people that are doing the work.
Thank you so much. Oh, sorry.
Well, Julie, as a patient, I just want to thank you for all that you do for us. And one comment I want to make about the engagement with the the patients and the family members is, what I'm kind of seeing too is that a lot of the patients right now are just struggling to stay healthy. And there doesn't seem to be a lot of energy on the ground for them to take on any other responsibilities or load in their life. So how can we get around that?
That's a great question. I think we're having those same conversations and talking about the healthcare workforce. You know, they took a pretty big hit with COVID and the pandemic and everything that they dealt with. And I don't think that, you know, we as people escaped that either. I think we're seeing that across the board with people struggling, you know, incredible levels of stress and burnout and figuring out how to take care of themselves. And so I think it's, you know, what I would choose to focus on is that this is our interventions, and our focus can't just be within the system walls or the healthcare system walls. We have to figure out how to engage communities. And that's where I think there's real rich opportunity is how do we engage communities and how do we help build communities that surround and support people? Because I really think that's our, sorry, Uber. I really think that that's the only way for us to get to support others is if we is the surrounding of the community, the people where they, you know, where they live, where they work, where they play, where they pray, all of those things. And I just feel like we have to surround people versus expecting them to pull themselves up by their bootstraps.
All right, thank you very much.
Thank you for sharing, Julie. Does anybody have any other questions?
Well, I just, again, my apologies for the background noise and the no picture and all the things. And I hate to sign off, but I just want to express my gratitude towards all of you. You are my why. And so I'm just looking forward for us to continue to improve the way that we get input and the way that we use the voice of all of you to drive our work. So thanks for your time. I really appreciate it.
Thank you, Julie. Thank you for joining us on this very important day of yours. It does mean a lot that you showed up.
Thank you so much. Great. Have a good afternoon, all.
Hi,
You
Julie.
too.
Thank you, Julie.
You know, Laura, can I just jump in on that, on Bob's question? Because I think it's a great question. And,
Sure.
you know, I know you came here to talk to Comagine leadership, and I'm not that, but one of the benefits of the hub model is to be really flexible. So as a differentiator and building on the PFAC model, where you're really making a commitment across time, the hub is offering opportunities for people to engage at their convenience, at their availability. So we've had hub members in other organizations that, you know, have had a health crisis, and so that we don't hear from them for 6 months, and then they're feeling better and they want to jump back in. So I just wanted to highlight the fact that the hub model was created in essence to be just super inclusive of wherever people are and wherever they can jump in.
Thank you, Libby. Does anybody have any other general questions for us before we move on to conference debrief? All right, thank you, Lindsay. So this, oh my gosh, I can't even, this Tuesday, we had our PFCC conference at the California Endowment Center, and we were lucky enough to have the Utah PFAC come and join us and present on some of the tools that they've created. And so we had Joan and Jan and Diane join us and present. But we have Joan and Jan here today, and I also know that Chris Severson was there. So we're curious, any of you can jump in and let us know how your experience was at the conference, and then let us know something that you learned, something new that you learned from the conference.
Oh, I'm happy to speak up. I loved seeing and meeting people in person that I've seen online for the last couple years that I'd never met them face to face. It was a great opportunity. There's a synergy there in person that just can't be recreated online, no matter how hard we try. So I had a great experience there. And every session I went to was so informative and so great. I went in particular to the one by Cedars-Sinai in their PFAC efforts, which are amazing. And I took lots of notes that someday I'd like to share with someone, but what a great model they have for getting feedback from past patients and from people who care about their healthcare experience at that hospital. Anyway, it was a great experience.
Thank you for sharing, Jen. And yeah, we would love to see your notes at the that session. I wasn't able to attend that one, but definitely hear some really good things. So thank you. And thank you for presenting as well.
It was very fun to present. And I love being with my fellow Utahns and with Chris also from the hub there. It was a bonding experience, and those are good.
Yes, yes. It sounds like you all outside of the conference had a great time with each other.
I'll just chime in that,
Yeah, thank you.
this is Joan, I really like hanging out with my peeps. And I want to shout out to Chris. I really enjoyed meeting Chris from the hub, and I just feel like we had a connection. Chris, you and I had a lot of fun. I joke about our little Uber experience, but these are the things that bond us. We finally ended up getting to the Mexican restaurant that we wanted. It was just, as Chris said, it was an adventure that bonded us. And we also got a chance to take, on Monday afternoon, I took our Utah advisors to Venice Beach, and really was a nice time. Jan was at the open house representing the hub. We have a Utah advisor that is just really struggling with a lot of challenges in their family, and just to be able to take her to lunch out at the beach and take a nice walk. We found a beautiful conch shell in the surf. Just really was special. So like Jan, I enjoyed the case studies this time, which kind of lend a practical note to it. In particular, I liked this CART idea of how they support parents in a primary children's kind of hospital. And a BSN nurse had this idea, and how it's fostered all these relationships. The parents run the CART, and they bond with other parents in like situations. So I like the practical applications of the case studies. And that's kind of where the rubber meets the road. So we had fun with our group, bonded, but I also enjoyed the sessions. Thank you.
Thank you, Joan. Yeah, I was in on that one too, and it was very moving. And I had shared with our team yesterday that was her first time presenting, and it was on that CART, and she did a wonderful job. And
she said she was nervous, but I thought she did great.
Yeah, she did a great job, and it was great to hear somebody doing something for pediatrics, but for the parents. I feel like a lot of times people don't really think about the parents when it comes to pediatrics. So yeah, that was a great program that they started.
Got to treat the family unit to treat the pediatric patient.
Absolutely. Well, we are so glad you were there, and thank you for sharing.
Well, I have to chime in.
Yes.
With my new peeps, Joan and Jan. I think that they didn't know me. Jan knew me a little bit, but the others didn't know me, and I think they may have been surprised because I was really kind of a go with the flow and let's have fun kind of person. Because why not, right? And the only thing that Joan forgot to mention is that we were in the only Mexican restaurant in the heart of Chinatown. So that was the other part of the adventure is we were adventurous in the food choices that we had, I think. What I wanted to add about the conference was from the open house the first day and through the second day, they really kept asking, how do we bring the humanity back into healthcare? And that was the focus. And it really resonated with me. And I wanted to share just a really short story. And this to me is what it was all about. But I was having a very minor surgery, very minor. But I was in an operating room, and it just so happened that my doctor and the nurse and the anesthetist, everybody in there was a woman, which I don't think played a role in it. But right before I went under, my doctor came over and she kind of patted me on the arm and looked me right in the eye and said, "We got you, don't worry." And that simple touch, I can't emphasize to you how important that one little, few little reassuring words and the pat on my arm. I would have trusted her with anything. But I mean, of course I was trusting her with my life. But to me, that was the humanity of the whole situation, was just the sense of touch and her reaching out just to reassure me. And I think we forget that so often. And I remember talking to my doctor when I went in for a follow-up, and I said, "You have no idea what an impact that you have by doing such a simple thing." And I said, I mean, she's my favorite doctor forever, which now, by the way, I can't see because I'm on Medicare. But but to me, that's bringing the humanity. And I think all throughout the conference, we kept getting reminded of the humanity. And I know I went to one session, and I can't remember who was in the session with me from the group, but it was you are not a number. And it was, Jan, were you in that group? The group that led that about not being a number and bringing in the humanity and bringing in that sense of individuality just was very, very impactful, Libby. So great job. You went into that session kind of going, okay, what am I getting myself in for? And it was absolutely fabulous. But just really enjoyed the conference. It's the first time that I had attended. So I really felt like I got a lot out of it and appreciated the opportunity.
Yeah, I was going to say something about that session too, Chris. It was Connie and Reese from South Carolina. It was entertaining and informative, and you could feel their love. It was really a great session.
You could feel their love and energy from a mile away.
We could probably hear it from a mile away.
Yep. They're amazing. Awesome. I really appreciate, seeing you all there. And just, I think being back in person, I think that alone brought a lot of humanity back to all of us. I'm curious, Bob, Savannah, Chris, do you have any questions about the PFCC conference or anything that the participants here have shared?
No, I'm just sad I had to miss it. I had some health stuff come up, and maybe next year I'll be there.
Yeah.
I was thinking, Lindsay, you might want to describe the conference. I'm not sure if Bob and Donald are have been familiar with it.
Yeah, absolutely. So the PFCC conference in the past has been a yearly conference. Libby, what year is this conference? I lost track with COVID.
I know, right? This was the 11th.
Yeah.
So we missed 2 years, but this was the 11th.
Yeah.
Daddy,
I'll mute you, Savannah. I think you got some kiddos back there.
sorry, I didn't hear you.
All good. All good.
Watering a plant while I'm in this meeting. That's why I'm keeping her occupied. So
No worries. So this was the 11th PFCC, and that's Patient and Family Centered Care Conference. And typically we get a really wide range of participants. There is typically a majority of patient family partners, patient family advisors. We actually saw that Libby asked for all patient family advisors to raise their hand, and just looking around the room to see how many patient family partners there were in this room of about 120 or so individuals was really inspiring. And so there's also the healthcare organizations that participate, and typical conference are kind of show and tells, you're promoting your best work. But this conference, the PFCC conference, it's really a learning conference for everyone to really collaborate and learn together. I think this one was different than any of the other ones that we did, because we also incorporated a challenge cafe. So that was really kind of addressing all of these challenges around certain topics. And then there were also workshops. So I sat in on a workshop that was reimagining care for Black women, where we did 15 minutes of community breath work. And then we did some mindfulness activities. So it was a lot more interactive. And I was so excited to have that type of interaction with the participants. But yeah, really just a chance to, bring everybody together in person around a common goal or focus. And like you heard, this year's was accelerating humanity in healthcare. So we did an open house for patient family partners through the PFA network the day before. And we asked everybody to kind of draw what humanity in healthcare meant to them. So we have these beautiful tiles that everybody put together, and just seeing them all just put a smile on my face. And then, we did a word cloud to open the beginning of the conference the next morning, and asked everybody in one word, what does humanity in healthcare mean to you? And it's the most beautiful word cloud I've ever seen, and we'll definitely share that out with everyone. But yeah, I'm really glad to hear from those that were able to attend that theme really resonated with you. Yeah, anything I missed, Libby?
Oh, did Bob have a question?
Oh, did you have a question, Bob? Sorry, I didn't see.
I was just gonna make a comment. We had our first board meeting in over 3 years with the ESRD Network 16. And being a patient, I was cooped up for quite some time, 2 years at least. It was wonderful. I love seeing everybody. We were in person. It was my first time in this kind of thing since COVID. And I don't know how you guys did it with the travel and everything, but I was exhausted after a full day of talking to people in person.
Look at us. Yeah.
I know. We're both
I mean,
hesitant to be on camera because we're both feeling like,
oh,
but-
yeah.
Yeah.
I mean, I got to drive home, but as soon as I got in my car, the radio was on and I couldn't take it. I just shut it off. It was super quiet.
That is funny. Yeah. It was like, I don't want to say a blessing and a curse, but everyone there wanted to be there. Like, they were so excited to get out and be in person. But you're absolutely right. It's draining, especially when you haven't done in-person meetings in that long.
Absolutely. Yeah, when I got in there, I said, I apologize in advance. I don't know how civilized I am anymore. But
I had to apologize so much, Bob.
Me too.
Yeah.
Bob, that is actually, I hadn't thought of that. The fact that I'd been out of practice of being in person. I had not thought of that. And so thank you for giving me that grace, because I've been like all day, what is wrong with me? I'm just dragging.
it's a skill that we learn, and we've had 3 years without, practicing. So
Right. Right.
I have to concur with Bob. I mean, I felt the same way. I was exhausted at the end of the meeting. It was like, what a lot of work, just one-on-one again.
I know. And to really, lean in, pay attention, be present with the person, that it wasn't just easy peasy anymore.
Just being engaged again,
Yeah.
So, yeah. It was a
I'm so
great
glad
meeting
you guys.
too.
What's that?
I say it was an awesome meeting after 3 years to see Bob again, so
That's
it
great.
was awesome.
That's great.
Yeah, there's so
Really
much
nice to see
energy.
Donald again.
Yeah, there's so much energy when you're in person.
Mhm.
And then when you step away, it's just like, oh.
Great. Great.
But it was great. Love seeing everybody there.
Mhm.
Next time we host something in person, we'd love to see even more of you there.
Yes. Yeah, I think we saw some really unique presentations by groups, health systems. We saw quality improvement organizations and others who were really demonstrating the power of partnership. So the power of doing exactly what we're doing, partnering with our health system, whoever that looks like, in this case, Comagine, to co-produce better outcomes, basically as an overall. And you guys in ESRD are certainly, ahead of the curve on all of that. So I know that you understand that. I think that the beauty for me of listening to our hospitals and Mountain Pacific and QIOs and others was that they were re-energizing their efforts. So a lot of organizations, as you know, during the pandemic, kind of sat back their patient family engagement. Some went forward with virtual, and then others just paused it. I think thinking the pandemic would be over in a few weeks. That's kind of the mindset we all had at the beginning. And so for me, I think what was really gratifying is listening to the presentations and really seeing how people are coming back. And, Leslie Martinez's work in LA County Department of Health Services around evaluating the impact and effectiveness of patient-family partnership. I thought that was her model that she created through her PhD program. It just is a great way to go. And that's an area that, as a community of patient family engagement specialists, we've really been missing that piece. Like, how do we demonstrate impact? It's great that it feels good, but how do we actually demonstrate that we change the way we're addressing sepsis? And so I thought that was a really great session. And the thing I love most about the PFCC conference is that all of the sessions are co-presented by a staff person and a patient family partner, and in true co-design. So I just wanted to share a couple of reflections, but I was so heartened to see the level of effort people are going to re-energize these programs.
Well, that's fantastic news. It really is. And I'm hoping that later this month, when the federal regulations are lifted for the COVID pandemic, Donald and I could actually get some more access to patients. Right now, like you guys, all we do is over Zoom, and it's kind of depressing because we're not seeing the whole population and finding out what's going on. So as patient mentors, I think coming up, we got hopefully a better venue maybe, or something, so we can get more educated on what's actually happening.
And more boots on the ground kind of action too.
Right.
Exactly. And for me, it's we hear mostly complaints. That's who comes to the support groups, right? So we're not seeing the good side of it. And I'd like to have a more positive attitude about this sooner than later, let me tell you.
I appreciate that, and I appreciate your persistence.
Yeah. All right. Well, any final thoughts on the conference? Okay, well, thank you to Joan and Jan for presenting, and Chris for showing up and learning with us and going to the open house as well. It was so great to see you all. And also there was another Comagine Health presentation. They did a case study as well. It was Seema and Alex who shared the process for putting together the focus group that they did, that I believe, Jan, that you participated on too. So great showing by Comagine Health. So good stuff, everyone. Thank you. All right, in our last couple of minutes, I think there's, I took over for Laura here because she's in transit, so I'm gonna run through. Yep. No problem. I'm just gonna run through a couple engagement opportunities. So actually next week, I know this is a little bit last minute, but Comagine Health is having their quarterly update. We're really just sharing information about our partnership with Comagine Health and, the success that we have seen with engaging patients and families in some of these activities. Alex, who had conducted the focus group on hospital utilization and primary care, she will be on to just describe their work because, after they did that focus group, they had so many other ideas of how to engage with all of you. So they'll be participating in that, but it's a really quick, I think 20 or 30 minute session. So if any of you would like to join, you can let Laura know and we can connect before Tuesday. And then there is the chronic kidney disease team at Comagine Health would like to hear from all of you about how they can best identify chronic kidney disease patients and interview them. And also, what are some of those best questions or, how to ask questions about chronic kidney disease so they can really help their primary care providers to identify or really see the importance of screening for chronic kidney disease early. Bob, I see you shaking your head. So, and maybe Chris is too.
We would like to see less of us fellow patients if at all possible.
Right, exactly. So I think they're really just trying to develop some messaging for primary care providers to highlight the importance of screening. So if you're interested in this, you could give Laura an email where we'll send this information out and follow up also. Or if you would like to pass it on to the ESRD advisory council members as well who might be interested. We're going to connect with Lisa Hall also to let her know.
All right.
All right. Okay, I think that is everything with 5 minutes left too. Any questions or comments, reflections, anything else we didn't touch on today? All right. Well, Laura will be following. Oh, did you have something, Bob?
I just want to make sure that you're going to be sending out an email with these slides so that we know who to email to and with each particular thing.
I was just going to say that Laura will get a follow-up out to you. Yeah. Laura will follow up with those engagement opportunities in the slide and the recording for anybody who missed today's session. Yeah.
Thank you.
Thank you all. Great meeting. And thanks. I know Julie's out of here, but it was so great to have her chat with us as well. So thanks to her and everyone. Now I will give you a whole 4 minutes back to do whatever you want with your day.
Get ready for the next meeting.
There you go.
Thank you, guys.
Take care.
Thanks. Take care.
Thank you. Bye.